So welcome everybody to our new HG4RR seminar. I'm looking forward to one more exciting event this year with great panelists and with the very important topics. I would like to briefly outline the process, and then we get started in earnest with the actual session. So just I have a small internet problem. So today's talk is called Impact Evaluations in Humanitarian Settings, Evidence on Food Security Outcomes from MENA region. And this is part of the Home Gardens for Resilience and Recovery series, which is organized by IGZ and ISDC, two German research institutes, with support from the German Federal Ministry for Education and Research. And we're very grateful for that financial support, which is very welcome. Next slide. The Home Gardens for Resilience and Recovery Network is an international research network which has a whole range of members, both NGOs and research organizations, especially in Asia, because we originally had a focus on Asia when we started 2 years ago. We've held a number of workshops, and we have some interesting publications, and also online, for example, on YouTube, we have an increasing number of videos that you can watch on past seminars. We show here our project website at isdc.org/project/HG4R. Feel free to visit us and get in touch if you have any questions. Next slide, please. On the 3rd of November, about a month ago, our colleague Pepin Schreinemachers from the World Vegetable Center gave a very interesting talk on school gardens and healthy eating. And if you're interested to catch up on that webinar, you can find it on ISDC's YouTube channel. You can also search for HG4RR and you should find it there. Next slide. A short advertisement before we start in earnest. If you're interested in how the COVID pandemic has shaped lives and livelihoods around the world, you may be interested in our parallel research project called Life with Corona. We have a website, lifewithcorona.org, where we post a lot of findings from an online survey into what people do and how they feel during the pandemic. We started going live with this project in March, and we've been collecting online data since. Feel free to take the survey. We have about 20 languages uploaded, so hopefully you can take it there in English or in another language as you wish. And we're very curious to hear from you and be grateful if you can share this great resource in your networks. Maybe Ghassan, we can also post the link again in the chat box. Yeah, it'd be great to hear from you about that as well. Thank you. Next slide. Today we have two fantastic speakers. First, there's my colleague Ghassan Baliki, who's a senior researcher both at ISDC and the International Security and Development Center in Berlin and the Leibniz Institute of Vegetable and Ornamental Crops, IGZ, near Berlin. Ghassan is a development economist who is interested in livelihoods in conflict and post-conflict settings, and he's studying food security outcomes and interventions in humanitarian settings in many different countries around the world. And Ghassan will give a brief talk about food security intervention in Syria. The project is ongoing, and Ghassan will give us some insights into early findings. Next, please. Second is my very good colleague and excellent collaborator, Hala Ghattas, who's the Associate Research Professor at the American University of Beirut and the Director of the Center for Research on Population and Health there. And Hala has a fantastic record of research on interventions to help marginalized populations, especially women and children, in the Middle East and elsewhere, trying to understand the determinants of their food security and the determinants of their health and well-being. And she's a very creative and innovative researcher, and she will talk about some work she has done in Palestinian refugee camps, understanding how community kitchen, a community resource, has helped improve both the livelihoods of the women who work in this community center and the children who were fed through it. And I think it's a very interesting combination of projects, one where we look at food security interventions, one where we look at a nutrition intervention, and they're related, of course, because both use healthy, fresh produce and help populations under stress to cope with the circumstances. And we're looking forward to both hear from the findings from the projects, but also how the projects went and what lessons we can learn from these projects and their implementation. So both presenters will try to pay attention to both these aspects. Next, please. So just some brief housekeeping announcements. We'll have the two presentations first, and I think it'll be interesting to hear both in conjunction, sort of back to back, and then to have the Q&A with all of you. And we will end sharply at 3 o'clock Berlin time, so 60 minutes after we started. If you want to pose a question, please use the Q&A feature. That we'd love to hear your questions there. I will be monitoring that as we go along, and I'll then post those questions to our two presenters who get a chance to answer them. And if there are any technical questions, please write to our colleague Gwen at the email that you see here. And just to say, as before, we'll record the talk and post it later on YouTube so that other people can catch up later. So without further ado, I'd like to introduce Ghassan and hand over to him and ask him to share his screen so he can give us his insights into the findings. Thank you.
Thank you very much, Tilman. Hello, everybody. Let me just start sharing my screen. Hopefully it goes. Can you, oops, started the wrong slide, which is, oh, here. Can you see this screen?
It looks good, Ghassan. Thank you.
Oh, fantastic. Great. Thank you. Welcome, everybody, and thank you for joining us today. I'm going to talk today about impact evaluations in humanitarian settings, both Hala and I, and talk about evidence on food security outcomes in the MENA region. My study will be mainly around Syria, and it deals directly with nutrition-sensitive agricultural interventions. But just to motivate the overall webinar, so we know that violent conflicts drive now about 80% of all humanitarian needs around the world. And there has been more and more evidence coming from both research, but also from practitioners, that there's big causality between conflict and food insecurity. And this is particularly coming more concentrated food insecurity in these conflict regions. Right? And the World Bank had estimated that around by 2030, around half of the population will be living in fragile and conflict affected regions. Yet, given all these kind of figures, we still lack insights on how interventions can best support people's welfare, as well as stability in these types of regions, and how do these interventions interact with the context, with this ever volatile and changing context in these regions. And also there's interest largely about not just about humanitarian assistance, but also how in protracted crises, especially with conflicts becoming more, can start issues. Impact evaluations generally and systematic reviews around nutrition-sensitive agriculture is not something new. There has been lots of evidence coming from different countries around the world. However, most of these studies do not come from conflict-affected or humanitarian settings. And the ones that come from these regions mainly focus on food transfers or cash transfers, rather than on home gardens or smallholder support or bigger interventions as such, right? So, and it's not because of the lack, as we know from our network and the work mostly that you do, it's not because of the lack of these programs that are taking place, but actually the difficulty in obtaining data due to security and ethical concerns, and also some practical challenges, both for implementers and researchers, given these volatile situations and ever-changing environments to design proper studies to have better learning, so to speak. So my talk will be on the impacts on nutrition-sensitive agriculture intervention and food security in Syria. And the objective of this particular paper is to look at the short-term impacts from a vegetable seed distribution program on food security. And this is just a small snapshot from a larger project, which is funded by CIDL, which is the Center of Excellence for Development, Impact and Learning in the UK. And the bigger project is called SEEDS, which study multiple complex interventions in challenging environments in all Syria. And we test different methods of how we can actually learn and about how we can better maximize impact and learn from that, given these challenging environments. Yeah? So this is kind of the overall objective of the whole project, to look both at the short-term, medium, and long-term impacts. So we study specific agriculture intervention in Syria, which provides both emergency support, including vegetable seeds and tools. So this is kind of immediate support to vulnerable households, as well as tries to achieve more early recovery support, now including the rehabilitation of irrigation systems to kind of create a better, more environmentally enabling farmers to have better access to water, as well as alternative income generating activities. And it mainly targets smallholder farmers across Syria, and they do prioritize female-headed households. So it's good to keep that in mind. So the idea of this program, and then how we kind of theorize the whole change, is that these direct asset transfers, including both seeds and tools, as vegetable seeds and basic tools, will increase the production in the short term, which will impact food availability of the households and reduce the use of harmful coping strategies. And in Syria, we know that there's been people relying much more on credit, particularly farmers as well, given now there's a hyperinflation, which kind of shows. So this is kind of one of the pathways we want to kind of see, the reduction of the use of those harmful coping strategies. Yeah. And the more kind of resilient recovery type of approach will improve the value chain and the sustainable local systems, which both at the community and the household, which in hand will strengthen resilience against recurrent shocks, which is something that's very happening. It's not just the war, but it could also be weather shocks. It could be also macroeconomic recessions, which is currently taking place, as well as we all know, COVID-19. And our hypothesis is that both those pathways, both on the community level and the household level in the short and long term, will enhance food security, general nutrition and health, as well as stability. So in this paper, we'll only look at the short term on food security, but the project is, as someone mentioned, still ongoing, and we're happy to report on the later in other papers. Yeah. So in terms of the research design, we use a quasi-experimental approach. So to compare villages and households that receive support, which we define as the treatment group, and the comparable village and household that receive no support, which we call the control group. And we follow up with the same household in a panel structure. Our aim is to go around 5 waves to look at the longer terms, but for the study, we only use 2 waves to look at the shorter term impacts. Yeah. And here we look at outcomes of food security indicators. We mainly rely on the food security score and the reduced coping strategy index for food security measures. And for diet quality, we look at household dietary diversity. In addition, with collaboration with Hala, who's also part of this project and joined us in this project, in future waves, we will also measure anthropometry, as well as anemia as a biomarker of nutritional status from both children and mothers of our beneficiaries and the control group, to see if there are any long-term health outcomes, which is quite exciting given such work in Syria has not been done before and its significance. So we look forward for that part. So just give you an overview of how the timeline of the data collection. So we started the baseline data collection from around 1,000 households, a little bit more end of 2018. We collected the midline we added a little bit larger sample to cover some attrition, which took place, so lots of people dropped out or moved, so we couldn't follow up with them. And currently we're collecting the end line, yeah, so which will be taking place early next year. And there's 2 more waves, yeah. So the data analysis now will use only baseline and midline. And how we selected the villages, and we identified where the beneficiary households are in these villages, and then the enumeration team randomly selected from the list of beneficiaries the sample that we needed, because we couldn't cover all beneficiaries, so to speak. So we took a small sample and it was randomly selected. The control household, however, is a major issue, and it's something that in this context, it's become challenging both ethically and in terms of also how one can approach it. So we try to be as much to select control household as close as possible in terms of the same eligibility criteria selected to use to selection of beneficiary households. So to make them as much comparable as possible. Yeah? So, however, we do face challenges, of course, and for that we do apply a propensity score matching to make sure that our both groups, the control and the treatment groups, are balanced in our analysis. And we use a difference in difference approach to estimate the average treatment effects on food security. Just to give you kind of one of the challenges that we face, and maybe something we can probably take into the discussion, that in such context is much more difficult, particularly in Syria, with ever changing from government held to rebel held areas. So accessibility becomes an issue, and also that has an impact not just on the implementation of such programs, but also on the design and the follow-up. So here, for example, I'll just give you so C is our control group and the T is the treatment. So we had similar control and treatment. However, around 256 households, which is our 2.0, could not receive any benefit during that year. So what we thought they would be our beneficiary group ended up not being our beneficiary group, so they dropped out, which is a large sample. So we had ex post to add another T2 midline to compensate for that. So the panel structure is not perfect. However, we try to kind of correct for that and understand where these differences come from, if they're structural or just random. Yeah. So, but to just give you an overview of that, it could, even if you design something perfectly from onward, after 1 year, it could be challenging. So it would be exciting to see in the long term how things change and how variable they are. Yeah. So just jumping quickly into the results, I want to just maybe flash out something before we talk, is that violence generally in Syria has been dropping down in the past year or so. So this is data from ACLED, which is Armed Conflict Location Event Data Sets, which kind of recorded data on violence around the world and in Syria using media data generally. And we see that there's a drop both in the conflict events, or what they kind of code as conflict events, as well as a number of fatalities. And this is particularly evident between our baseline and midline data set. So it has to take into account that change in our analysis, which affects both our control and treatment groups. Yeah. And also another kind of interesting thing to have in the background is that if you look from here, we show the SPAY index, which is the participation evapotranspiration index. So which kind of measures, it's an index used for measuring drought, and we see that everything below 0 kind of indicates higher amount of drought. Around 0 is good. Above 0 is too wet, like more flooding. So in principle, if you look at the 12-month averages, which is SPAY 12, which is the gray line, we see that like in Syria, they have been witnessing a long period of drought, which has a big impact on our program and our study because it's mainly agriculture. So access to water could be an issue. But however, we see a big jump between our baseline and midline. So therefore, there has been lots of rain, and it kind of ended the period of drought that took in Syria like 3-year drought period. So it's something also to take into account while we look into the results. And here we take, this is using our survey data, and just to give you a better feeling of what kind of shocks households do face between the baseline and end line. So the light gray one is from the baseline, and the dark gray one is from the midline. And we see, for example, drought has dropped sharply. So in baseline, around 67% of households report there's drought. And given that also the data which we proved through satellite data, now only 7% said there's an issue with drought. Also, there's a reduction in crop pests, which probably correlated. However, we see other issues that farmers and households do face, which is increase in input costs. Yeah. So it would be, and this is kind of with the hyperinflation wave taking place in the region, as some of you might know about. So therefore, one can see that the households at different times face different shocks. And this is kind of an issue with the implementation. Maybe some of you would also know that what has been planned in 2018 as a support of seeds and distribution without maybe irrigation support could be an issue, yeah, given the drought. But it seems now that maybe access to other market tools or to buy input costs, like for productive assets, for example, is higher, and that the farmers face different types of issues, yeah, as soon as the program starts to be implemented. So, so that's something one has to kind of keep in mind while working, and be able to track these things to understand how their impacts on the intervention as such and its outcomes. Yeah. So here, after balancing, I want to show you kind of a bit comparison of a little bit of the sample we're working with. So I refined the control group to have it as much similar matching to our beneficiary group, and we see the distribution is quite similar at the governorate level. And this is kind of the governments we cover: Al-Hasaka, Aleppo, Suwaida, Dar'a, Deir ez-Zur, Hama, Homs, and Quneitra. So we see also that percentage of males around above 50%. So it's mostly female-headed households and male-headed households equally. The age is around 50, and mainly they work as crop farmers, yeah, most of the households. And we also see a balance between in terms of education. So that makes us, at least from the household characteristics, that these two groups to a certain extent are comparable. So therefore, any changes we do observe in midline can be attributed causally to the intervention. And here I show 3 measures of the food security indicators, and which most of them show improvement. So first we have the food consumption score, which has increased. If you look between baseline and midline, so this is the average, was 53 points, and it has went up for both control and treatment. So we see general improvement in Syria, which reflects the context that I described earlier. However, still we do find the impact with a mean of an increase of 6.8 points, which can be attributed from our program, which is significant at the 1% level. Similarly, the household dietary diversity score shows a slight improvement, however, that's not significant. And the reduced coping strategy index, which the lower it is, the better, the more food secure people are. We also see a reduction, and it's just about to be significant. However, this is something it's significant. 1.29 points is quite significant. However, it's not strong enough to be significant, to be driven mainly from the program impact. But generally, with these signs of these variables, food security variables are as expected, and which shows that definitely short-term impacts, the distribution, the provision of seeds and tools has had an impact on the food consumption of the households, and which kind of acted as a kind of let's say, as a safety net for them, given the high increase of costs that we have witnessed during that year. Here I just going back and focusing, giving the importance of being female-headed households, particularly with the vegetable seeds growing in Syria and the plantation. And we see here, by breaking down between male and female, the comparison of all those indices, as you see in the green boxes, that female-headed household benefit much more. Yeah, so we see as before it's around 6, but that's on average, but around 10.7 is actually benefit from female-headed households. So it makes sense that these programs target more vulnerable populations, particularly female-headed households, because they seem to benefit most out of them. And also we see a significance in the household dietary diversity score, which is significant at the 1% level as well. And coming back to my point as well, that earlier, is that maybe the distribution of seeds and tools by itself is not sufficient, and where it maybe moves from looking at this part of the intervention and into the more complex different parts, looking at the recovery and rehabilitation of irrigation systems, we see that people who have land of water access is key to help ensure that these interventions have an impact on food consumption. Even if you look at people who don't have water access into their land, actually it's negative. So they don't benefit much more, even not at all, yeah, from having the intervention if they don't have access to water. So it's something also for implementers to think of, not usually distributing the different benefits across more populations, but concentrating particularly in such settings, a different bundling of different interventions that will help consolidate the resilience of households. And this takes me to my summary and the lessons learned. So the key impacts, we do find stronger food security from the distribution of seeds and tools, and it's something in the short term, and it will be interesting to see if that has an impact into the longer term, and if it's sustainable. Female-headed household benefit most from some such programs, and access of irrigation is key to make the program impacts work. And lessons learned, which maybe we can take into the discussion, is that it's important for such programs to have these kind of impact evaluations, because it helps them understand their targeting, especially for long-term phase-in programs. So to continue targeting maybe more female-headed households, because they do benefit more. And as well, as I mentioned earlier, to bundle different types of support to achieve stronger impact rather than distributing them thinly across. And as I kind of proved to you, and also the challenges that I raised, especially with the dropouts from the sample, impact evaluation are feasible in these settings. But of course, we have to think of different designs and methods that remain rigorous, so we can actually learn and produce evidence from, however, flexible in a way that it can adapt to these very changing environments, both in context and in terms of the programming and the implementation. Thank you very much, and I look forward to your questions.
Thank you, Ghassan. That was great. If a tad long, but very informative and very interesting. And as I said, I'd like to move straight away to the next talk so that we can hear them back to back and also learn sort of from the synergies and similarities and maybe contrast between them. So Hala, over to you, please.
Thank you so much, Tilman. I'm just trying to project. Okay. Sorry. No.
That's looking great. Thanks.
Sorry, because it's in the same.
No, it's back to.
Sorry about that. One second. There we go. Okay, thank you so much. So I'm going to talk about another intervention that was conducted in Palestinian refugee camps in Lebanon. And really the link between these two is the context, which is a context of protracted crisis, if you like. So Palestinian refugees are protracted refugees. And I'm looking or presenting results slightly further downstream and looking at impacts on nutritional status as well as food insecurity in this context. So I'm presenting data from a community-based intervention which linked community kitchens, which I'll refer to here as healthy kitchens, to a school food program, which I'll refer to here as the healthy children component of the intervention in Palestinian refugee camps in Lebanon. And this was work conducted between the American University of Beirut and the University of Maryland in collaboration with UNRWA. So just as a quick background, Palestinian refugees have faced decades of social, political, and economic marginalization in Lebanon. And they experience multi-generational poverty, food insecurity, and chronic disease. There's also a very large gender disparity in labor force participation, with women generally having very low participation rates. And at the same time, we've observed that children have very low quality diets, and this often begins with school-aged children. There's also a lot of literature on community kitchens that comes from largely developed country contexts, mainly showing impacts of community kitchens on self-reliance, social support, mental health in people who participate in community kitchens, but there's very limited evidence of the impact of this kind of intervention on food security, and very little evidence coming from low and middle income countries from community kitchen based programs. So in this context, we aimed to investigate the effect of women's participation in a community-based cooking program on economic and food security status, women's empowerment, social support, and mental health outcomes, and then look at the downstream effects of this intervention in children who are receiving the food that was prepared by these community kitchens on their diet diversity, nutritional status, and some educational outcomes. So in brief, so this is a study that was designed as a quasi-experimental design. We had 2 healthy kitchens that were established as small business enterprises within community-based organizations. And women were recruited by the CBOs to produce a healthy school snack for school children. This was largely fresh food that was prepared daily, including fruits and vegetables, dairy, and meat in the menu. Women received training on entrepreneurship, food safety, hygiene, and child nutrition. There was a very participatory approach in the development of these traditional recipes for the school snacks. And women were employed on a rotating basis and generated about $110 per month by participating in this intervention. We looked at the healthy kitchens component using a mixed methods approach. This was a small number of women, and so we did quite a lot of qualitative work to try to look at the potential impact of this intervention and the process by which this intervention may be having impact, as well as collecting some quantitative data. And in overall, this income that women generated contributed to household expenditure. So we had an increase in total household expenditure, in expenditure specifically on food and on clothes. Women also had an increase in, or there was an increase in the reporting of their ability to make decisions around expenditures. And then generally there's a lot of qualitative evidence that this was an intervention that led to women feeling economically independent and increasing their feelings of self-worth. So an example is a woman stating that this allowed her personality to get stronger, that before she was living and now she wants to live and prove that she exists. So these quite strong sort of feelings of empowerment as a result of participating in this kind of intervention. There was also an improvement in food insecurity, as well as a decrease in food-related coping strategies, a marginally significant decrease in borrowing food, but also a significant decrease in accepting gifts. And we also found an improvement in mental health in women, and this was largely related to this change in social setting that allowed them to get a break from the hardships of home, and this community enterprise that they were feeling that they were able to contribute to their household income, and at the same time interact socially with other women in this setting. In terms of the children's component of the intervention, we basically had 2 control schools and 2 intervention schools that received food that was delivered to them as a healthy snack daily, that was eaten during recess, and that was sold to them at a subsidized price. And they received food 5 days a week for 8 months. We had about 650 children in the control group and an equivalent number in the intervention group. We analyzed these as low participation and high participation, and we can have a discussion around issues around attrition and participation in the discussion if people are happy to do that. We collected data at baseline and at end line at the end of a school year on various household socio-demographic variables, expenditure, food insecurity, as well as nutritional status of children, and some data on academic, so absenteeism and academic performance. And I'm showing some baseline data from these children, just to highlight a couple of points. The first is that about 40% of children at baseline came to school without having had breakfast. This is a highly food insecure population, with about 50% of children coming from food insecure households. And in terms of their nutritional status, remember, this is a middle income country, and Palestinian refugees have been here for 3 generations, and their nutritional profile is very much one of overweight and obesity being more prevalent than stunting or underweight, but actually anemia being significant as well. And so in this context, what we found was a significant increase in diet diversity in those that participated for more than 4 months in the intervention as compared to the control group. And then when you look at what components of diet were actually impacted, we see an increase in chicken and meat intake, a reduction in desserts and sweetened beverage intake, and again we can have a discussion around diet quality and the role of these fresh food interventions in diet quality in children, and then an increase in dairy intake. And we also found that in those that participated for more than 4 months, there was a significant increase in hemoglobin, but no impact on anthropometric outcomes of children, which is to be expected. In terms of knock-on effects, we actually see a significant reduction in absenteeism in both the low participation and the high participation groups. So those that were in the intervention schools that participated for less than 4 months, and then those that participated for more than 4 months. And really, we've written about 3 papers from this study with a lot of lessons learned and a lot of reflection on how these interventions work in these kinds of contexts and what their potential for sustainability is. And in this context, what has happened is that these community-based organizations have actually, as a result of these kinds of interventions, established themselves as social enterprises that cater healthy food. More recently, they've expanded to actually add rooftop gardens to source their food from themselves, whereas in this intervention, they were sourcing food from the local market within the camp. schools are a constant market at the end of the day for this kind of intervention, and really offer an opportunity for sustainable livelihood generation for marginalized women in this context. We struggled with various challenges to sustainability that relate largely to a lack of policies, school regulations around allowing this kind of delivery of food to schools, but also in terms of restricting competition from unhealthy food vendors to schools. And the design of this was a subsidized meal. And the pricing of the meal, the fact that there was some contribution that was expected from children, actually did lead to fluctuations in participation in a context of high poverty and food insecurity. But at the time, UNRWA was adamant that this not become a completely funded school feeding program. And again, we can have discussions about this in the discussion session. So in conclusion, what this intervention showed was that it provides some evidence to this model's potential to contribute to the advancement of human capital, really, of 2 generations of protracted refugees, equipping them with means to improve their future livelihoods. And I think I'll stop here, but really sort of wanted to see in the discussion whether we could think about these models, and there are many that are now providing school gardens and linking gardens to school feeding programs, and the need to really evaluate the impact of these on some of these outcomes, both for the children in the schools, but also for the communities more broadly, such as the women in the community kitchens. Thank you very much. I hope I didn't go over time.
No, you were exemplary, putting Ghassan to shame. And thank you for such a beautiful and informative presentation. Just the perfect mix of numbers and beautiful images, yeah? Slightly belying the somewhat dire situation of the children and people that you study, yeah? But very beautiful imagery. It's a very inspiring research in general, thank you. And I think it's these different dimensions and different issues are very interesting to see in the context of our network, where we are looking for, you know, relatively easy and simple and yet maybe quite powerful interventions which can really shape people's food security, nutrition outcomes, and also their psychosocial well-being, the gender issue that you emphasized at the beginning. Yeah, I think something that we have found in other settings as well, and which is not something that many people designing interventions immediately think of, or it's not what people associate with gardens. Yeah, but it actually turns out to be a very important dimension. And I think these are understudied topics. So I think it's great that you have this really comprehensive evidence and, you know, studying it from so many different angles. Yeah, lovely. Thank you. So we open the question and answer, and we have about 20 minutes for that, which is great. Maybe it's sort of fair to start with Ghassan because people had more time to, you know, digest his part, and then we come back and as questions are posted on the Q&A, we'll look at them. Ghassan, you have several questions here to you. One is from our colleague Isabel Mank at Heidelberg, and she asked a more question on the practical aspect of setting up a home garden. Was there any guidance on how households can or should use the seeds in Syria? And did you also assess maybe qualitatively what the participants remarked on, what worked or what did not work?
Thank you. So maybe I start with the last answer. Qualitatively, it's much more challenging, particularly in contexts like Syria, to actually have a group of people come and discuss about issues and challenges and well-being, particularly given this context. So maybe it's much easier to deal with numbers, working especially with the agencies and the ministries in Syria to keep a clear questionnaire, they approve, they know what's been asked, rather than have an open discussion. So this is something one has to kind of keep in mind, which has its limitations, and it's key, I agree, to look into the pathways to understand better, particularly when it comes in this changing context, definitely. With kind of the implementers, we did, so as I showed you the statistics, it's mainly farmers or people who have worked in farming that were kind of part of the beneficial group. So they do have experience. However, I'm not sure if we did provide any exact training about or guidance about how to use the seeds, if I remember correctly. So it was more kind of more support. It's kind of asset transfer, direct asset transfer, if you may. And we actually still track if people, if they consume seed, for example, as part of the harmful coping strategies. I didn't show. So that kind of, and we see it's around maybe 1 or 2%. So we make sure that the seeds are actually being planted and used for production. And I didn't show it here because of time, but we also see some small significance in the production of eggplants and other type of the seeds that we provided, and tomatoes within the beneficiary group as well. So there has been, and given that the rainfall, so it has been a productive season overall. Yeah.
Okay, thank you, Ghassan. Yeah, and if you have any follow-up questions, either feel free to post again or also to drop us an email. I think Ghassan had his at the end of his talk. It's yeah, so feel free to get in touch if you have more questions. We then have 2 questions, Ghassan, on sustainability. One from Chinello, who asked why the intervention via home gardens for resilience and recovery, and if results show low and insignificant impact, what does that say about the method of intervention for sustainability? And in a related fashion, Naji Sulaiman is asking, what about the sustainability of this impact? And do you think that will continue? Also, Naji asked, what's the source of the distributed seed, and did they include locally adapted varieties, which is a great question.
Yes, they are locally adapted varieties. Actually, there has been kind of some more support about creating nurseries and seedlings for other crops as well, not just so kind of to support more community of access to seeds. But indeed, yeah, this is local varieties. Sustainability is the key question here, right? And this is kind of the study that we are looking to more the longer term impacts. So we want to be able to track that. Of course, given this environment, we are not designing as such the intervention, right? So we cannot kind of experiment of what works. But as I kind of hinted on that, as you see, bundling different types of intervention, the more recovery-oriented type of interventions into irrigation of rehabilitation systems, getting access from water and pumps and solar systems to get water access to the land or to the gardens or to the areas, especially in the north and northeast of Syria, is quite key to ensure sustainability of productive asset distributions. Yeah, can we test it directly? Not, but we will experiment with different types of ways to be able to kind of simulate it in a sense, if I may, in the other future, to see how such a counterfactual could have led to different types of sustainability and impacts. But of course, depends on many other factors, especially for us as a challenge. I think this is kind of key here, that working in this environment with a changing sample, and we always have to add a new sample. So that could pose more kind of a more methodological challenge to help us ensure that our evidence is rigorous, right? So, thank you.
Thank you, Ghassan. Yeah, we have another question from Abdul Karim Abelubu. Sorry, there's a possibility that those producing vegetables could share the produces to non-targeted households for various purposes. You know, it's income or donation for free, etc. Yeah. So how did you account for this in the study? The fact that people might share what they grow, and then there's a sort of positive spillover, I suppose. You know,
this I have a direct answer to it. So this is a clear answer. Thanks. No, this is how we did the selection. So the control villages, we selected them from within the same sub-district. Syria is large. This is over Syria. It's not just a small location. Yeah, so it has the same agroclimatic condition, the villages, but it has its own market. Yeah. So in a sense, we try to kind of separate the intervention village from the control village, and then we selected the households from those villages. So the spillover effect in a place like Syria, where accessibility even of traveling roads and stuff is hard, to one vegetable produce to go from one area, even within the same, that it could be, yeah, but we cannot be sure. But I think given this is a small scale type of intervention, we would not assume there's a spillover effect towards the non-targeted groups, especially on this part. The water, which we're going to evaluate later, is much more challenging, right? Because the distribution of the water and the irrigation system can benefit a larger community, so it's hard to kind of separate who actually benefits and not.
Okay, great. Thank you, Ghassan, yeah, for further explaining the study and some of the implications and meanings. Hala, now you have a whole great set of questions coming up for you, and which is great. Maybe we start with Siba Brata's question, who asked, what is the role and support from the government or UN or similar agencies? And do you think this could be scaled up and extended to cover schools? Yeah, that's a great question. Yeah.
Thank you for that question. So this intervention was actually designed almost as a pilot intervention, and it was implemented in UNRWA schools. So in our context, Palestinian refugees, there are schools within Palestinian refugee camps, which are urban largely, that are run by the UN Relief and Works Agency for Palestine refugees. So in this particular example, they facilitated access, and they are very much the ones with whom the discussion around policy in terms of integrating into their bidding processes the possibility of giving an advantage to these kinds of community-based enterprises. So in this context, the role was sort of a collaborative one. It was the intervention was designed very much as a research, as a pilot research program. But in the context of Lebanon more broadly, at the moment, the World Food Programme, in collaboration with the Ministry of Education, is actually implementing a school feeding program, a nationwide school feeding program targeting public schools in specific regions that are particularly vulnerable. And they are actually at the moment considering developing up the same model. So they've been taking a lot of the learning around these kitchens and these community kitchens, and they're going to be implementing a few of these kitchens within some of the communities in order to use these to source the school feeding programs that are currently ongoing. As a sort of model where children buy in, it is actually financially sustainable. So the model we used could be scaled up and could sustain itself. Really what is required is buy-in, as well as for us there's the issue of competition from other vendors within the school, and it's really around regulation within schools to constrain unhealthy food vendors in schools that would allow this to be scaled up more broadly.
Okay, thank you, Hala, for that explanation. And then Chinela has another question, this time to you, Hala, and asking two questions. Maybe I turn them around because the second one fits well with what you just said. How can this be applied in suburban areas in developing countries, you know, where maybe the space for gardening is harder to come by? Yeah, that's a legitimate sort of concern. And then the related question is, could you explain, please, by what you mean by controlled low and high participation? Thank you.
Sure. So this particular intervention largely sourced food from the local market in an urban context, and then added, sort of supplemented some fresh food from a rooftop garden in an urban context. So this is a sort of slum-like kind of setting, very, very poor areas where they have started to consider the use of roofs for some of these gardens. And then in terms of high and low participation. So for us, a control school was a school that did not receive the intervention at all. And then within the schools that did, so in order to allow us to compare and to be able to do a difference analysis, we had intervention schools. Now, what we noticed was that in these intervention schools, children opted in and out of the program throughout the school year. Overall, about 70% of children in intervention schools participated, but about half of those, or a little bit less than that, participated for less than a total of 4 months, whereas the others participated for more than 4 months. And so those are what we categorize as low and high participation groups, just to see if a child received the food for a longer period of time, whether the impacts were more significant, and that was the case basically. And so that's why we present the data by this participation level basically.
All right, great. Thank you. We also have a question about fruit. Our colleague Irmgard Jordan from the University of Gießen is asking about the level of the fruit consumption among home garden users and students at school. Is the consumption level sufficient? Now, looking at a vegetable research institute, I must say that eating fruit is good, eating vegetables is better. But nevertheless, we'll allow this question. And Hala, can you say something about fruit consumption?
Sure. So in this context, what we find is that food insecure households have lower consumption of fruit, particularly. And then so the sort of reductions go initially the sacrifice is on meat, and then vegetables and dairy follow. Now in this intervention, we actually provided fruit in the intervention, but it's also, so I need to sort of say that in this context, there's a very large fruit market in the camps that actually that actually sells quite sort of fruit trees in this intervention at all, but fruit was provided as part of the intervention, and we didn't see a significant increase in fruit consumption, I think largely because in this subpopulation there is a large fruit market that people do have quite a lot of access to.
Yeah, I guess maybe Lebanon in general, even in an urban setting, it's not that
if
difficult.
I may, I don't know, maybe I think much more frequently than any other region. So people don't sacrifice their fruits or vegetables over other staple crops, for example, even in our times.
Yeah. Okay, thanks. Yeah, of course, the diversity of these is very important. Yeah. And for you, Hala, the Healthy School Project, if this was a fairly short program or intervention, you know, what's the suitability of the entrepreneurial as indicators? Yeah.
Sure.
How much change would you expect to see in that period that you observed?
So, sure. I think for us, the anthropometry was largely for us a baseline. Regional status of these children was a baseline, largely to know sort of how to target. In terms of what we really aim to do is increase diet diversity as opposed to increase energy intake, because because of the higher rates of overweight and obesity. So, you know, we took the measurements at baseline. We took them again at the end because we had the equipment. It was easy to do. And I guess from a sort of hypothetically changes in weight, but it wasn't, I don't think it was long enough. So for us, anthropometry was largely to assess the status at baseline and really ensure that we weren't doing harm in this school food program, as opposed to sort of increasing energy, which was not what was needed in this population.
Right. Okay, great. If you have any further follow-up questions on that, please feel free to type it in the Q&A box. Yeah. And now there's several questions on sort of trainings and other advisory services, including extension services. So Margaret Koyenikan asked how and where which organizations provide extension advisory services on home garden. It's actually to both of you. And Elizabeth Westerway asked, are you doing permaculture training to empower individuals, households, schools, or communities? Yeah, maybe either or both of you could briefly address those.
I'm happy to answer, Mike. So in principle, given the scope of this intervention, it's in working with different regions. Most of the work and the distribution is done through the Ministry of Agriculture within Syria with the support of the Food and Agriculture Organization. So this is kind of provides the expertise within each government from the extension services. So that's it's kind of this work hand in hand in order to provide both the support. However, we don't provide additional training, again, because this is meant to be a immediate relief type. Training was not part of this kind of emergency support. And on one hand, we mainly work with people who have already farming background or own plots of lands, and so it was kind of maybe less incentive from the implementers' point of view to invest more money into training rather than the needs. Yeah, so that's something we have not considered within the context and given the scope of the study. But in other studies in Syria, we have tested also different types of training. Like so, not directly directed to permaculture or the home gardens, but other types of training like CSA and other types of and we haven't find any much impact. If Tilman maybe remembers the study, you know, we find that people just need seeds. Yeah, people just need access to things. Yeah, they don't want this. We actually be able to test the different arms of the intervention between training and training plus seeds, or seeds plus, what we called them at the time, and the different study, and we actually find the trainings had no impact as such. Yeah, especially within this target group, right? So, but it depends, of course. Yeah. So, and in this study we haven't done so, but it's worth considering in other settings, I'm
sure. So in NGO, for us, the sort of more intense training with the women was around the food preparation and ensuring sort of the standardization of healthy meals and the use of fresh produce in healthy meals. So yeah, I think I'll stop there. So we didn't assess sort of the impact of training itself, because we trained all women in the kitchen, and all of the community-based organizations were trained when the school garden, the rooftop gardens were established.
Yeah. Okay. Thanks. There's a question which I'm not sure we can answer, but let's have it anyway. How is soil health being improved to ensure food is nutrient dense for positive health outcomes? I'm wondering, Ghassan, that we had some trainings in the study program, in the intervention in Syria, but actually the trainings didn't really, they had all different types of activities, but they didn't really.
not in this particular study. In different studies, we had some with discussion with implementers and the other issues. Soil in Syria, maybe in some regions could be an issue, but it's mainly irrigation that actually the problem to be able to do so in Syria. So, and it wasn't even part of the program implementation. So, so it's really, if I may, yeah, and how much nutritional impact it has on the
of the study, right? So we can't really comment on that. And maybe the last question from the audience, and I'm not quite sure we can answer it here, although we have seen it in previous seminars. So Kingdom asked, what's the effect of the gardens on the thermal comfort of homes established during the study? We have grow fruit or vegetable, or even more, you know, that they some sort of agency out of that, but they also benefit from the shade provided, and they find that in the summer their tents in the camp are more livable in and more agreeable. But I'm not sure that was a topic that I considered. Probably not, right? It can be an important benefit of small-scale home gardening.
I know where I come from. Lebanon, we used to have the small grapes, like the vineyards for summer protection. That's something we and we could actually pick and eat the grapes. So this is something I know from that, but more than that, I can't provide.
Yeah. Okay. And then after the last question, we have the very last question from Eva Christensen. In the literature looking at other regions, nutrition was not improved via home gardens unless accompanied by SBC or nutrition messaging. Did you include this in your studies? Yeah, maybe a quick comment on that, and then I'd like to give both of you a chance to have a wrap-up comment, and then we finish.
I do agree. I think from removing my Syria hat and the region, the context, I think SBC is key. Yeah, especially, I think maybe Hala can answer more. It's about how you cook at home, how you do the behavioral change, what to eat. I think these are much more key things than actually adding one more vegetable on your plate. And I think Pepin also has presented something last week which kind of touched on that. So however, in our context, given the emergency and the scope of the thing, we didn't do SBC. It was more kind of emergency relief. So, but I would assume, yes, that's key. That's important from my point of view.
Yeah. In our context, there was a whole program, a nutrition education program that was implemented in all schools, both control and intervention schools. So in fact, our intervention was, the control was the SBC, and then the intervention was SBC plus the food-based intervention. So yes, very important. Thank you.
Okay. Yeah, great. Thank you. That's good to know. So we're at the end of the seminar. We had a very engaged audience. Thank you to the audience for being part of that. I'd like to give both of you a chance to maybe have a final comment, Ghassan. What is that like to share? Some further lessons learned?
Thank everybody for attending. Yeah, I think lessons learned. Yeah, I think the lessons learned. I think we can do even in very hard contexts. Impact evaluations can work, even not as rigorous and experimental as from a research point of view it is, but it's something that we can learn from, and it's something to take into account even given the current circumstances of COVID or not.
Yeah, okay, so research matters. Yeah, thank you. Hala, what would you like to share as a final thought?
I think for us, sort of lessons learned are very much some of the externalities. So, you know, these interventions can work very well when everything is controlled, and that sort of real life externalities like things. So the policy level issues that need to come in place at the same time, the regulations in schools, you know, the ability to bring in some structural support, if you like, for many of these interventions is also important. So I think keeping in mind some of the externalities to the interventions when thinking about the development of these interventions and important.
Thank you very much, Hala, for sharing that. Thank you both for participating, and that concludes our last seminar this year, but we'll be back next year. We'll announce a course. If you would like to join our mailing list, please feel free to write to Gwen, the email on the screen. We'd love to hear from you. Thank you very much. Happy holiday season and have a great start into the new year. Stay healthy. Bye-bye.
Bye, thank you.